Hiya. So this is a little bit about concussion. Now, simple and complicated head injuries are largely covered by the NICE guidelines. Obviously, if you're worried about whether or not you need to CT a child, then come and find a senior. But concussion is pretty common. And what are you going to do with the kid who, quite frankly, is well out of it but has a normal CT? So concussion is dysfunction of the brain following a head injury. Thinking about what this means in practical terms. What does the brain do? Well, it allows you to tell you where you are, what you're doing. It processes all the information and presents it in a way that you can understand. It generates memories. It allows you to retain information that you've already processed. And it allows you to walk and talk. So if all of those things are kind of a bit lost in the moment, that is going to affect your patient, and they're not going to be able to process information that you give them. They may not know what's going on. They may not generate any memories, and that can be really, really scary, because one of the other things that your brain does is obviously help regulate your emotions. And if those are not going to be regulated and you're having real difficulty processing the information and you're not generating any information, you're going to be very disorientated, and a lot of patients find this really scary. There aren't physical changes in the parenchyma with concussion, so you'll probably have a normal CT. Of course, you can get a concussion with physical injury to the brain, and you get brain injury that is not necessarily explained by the changes that you see on the CT. But what we're really thinking about today is when you've got a normal CT or no evidence of any physical brain damage, but clearly the patient in front of you isn't functioning properly. It is a true functional disorder that's fully accepted by the medical profession, which is really interesting. It's much more well accepted than something and well understood than something like complex regional pain syndrome. And it is just worth having a think about your attitude to concussion as opposed to your attitude to some of these other things that can present after an injury. So symptoms can be memory loss, speech difficulties, emotional lability. A lot of these people can be really upset. They can't concentrate, they can't focus, they can't do their schoolwork, they can't watch TV, and that might be because it's so confusing because they can't remember the beginning of it, or they just can't concentrate for long enough to process any information. In terms of physical symptoms, headache is really common, nausea and vomiting, blurred vision and coordination problems. Now you notice that a lot of these would together fit the criteria for the NICE criteria for having a CT scan if the patient presents acutely, and certainly a lot of patients with concussion may end up with a CT scan, and that's fine. You're not going to expect every CT scan that you do to be abnormal. If every CT scan that you do of the head is abnormal, then you're not doing enough. There are others too. You just have to be aware that the way that this affects people can be a little bit unpredictable. So tiredness is a really, really common one. The course is really unpredictable, and it can last for a few months, but hours to days as well, and that can be very difficult for parents who are trying to plan how to manage their lives and their situation at school. And you just have to be really honest about the fact that you don't know what's going to happen. So I want you to have a little think about this in your head. So you've got a teenage boy who's come off his skateboard and now has significant memory loss. He's freaking out. He can't remember where he is or why, and he's hit his head. And the parent's looking at you like, you need to sort this out. You've got a child who appears to be brain damaged, is completely stressed out, who's not normally stressed out, and they want you to manage that. So things to think about. I mean, what guidance do you need to use here? So the first question is, do they need a CT? In order to say that they've got a concussion, you need to make sure that they've not got a massive bleed, and that is important. And they may well do, and that's fine. So, we'll get cracking, sort that out. What are you going to say if it's negative? So you examine this child, you look at this child and you think, well, actually, this really looks like a classic concussion. You can't be sure that they've got nothing in their head, but you're going to arrange a CT, and you need to prepare for the parents for it might be negative, but this child might still be behaving like this. Have a think about your explanation and how you're going to phrase it. How are you going to talk the family through the process? So they're really worried. You've told them that you're going to scan their child's head for a bleed, but it might be negative and they might still be like this. That's really anxiety provoking. How are you going to talk them through it? You've got to be clear that there's uncertainty, because there is. You don't know whether the child's had a bleed, you don't know when they're going to get better, or even if they're going to get better. What would need to happen before they go home? So even if they have a normal CT, if they can't remember who they are or what they're doing, are they really safe to be at home? I had a teenage boy the other day who couldn't remember the way to the toilet. They still need to be safe to go home. They need to be at a level of functioning that you'd be okay for them to wander about their house and know they're not going to do anything any more dangerous than usual. So let's think about compassionate things to do. You've got to think about antiemetics. Okay, nausea feels rubbish, and with a normal CT, if they're vomiting all the time, you might want to think about maybe you could get rid of that. Not everybody will need them, and ask a senior before starting them, but do have a think about that. Same with headache. If they've got a really sore head, which is perfectly reasonable, give them some pain relief. Not knowing what's going on is scary. And so sometimes just writing down, why they're here, that they have hit their head, they're going to have a scan or they've had a scan, can be really, really useful and really, really helpful. Many teenagers will ask you the same questions again and again and again, and that's because they can't remember what you told them. Writing it down so they can just have a look, it gives them something to hold on to physically, and that's quite reassuring. So discharge advice. Our head injury advice leaflet in this department has 2 pages of advice about concussion. It is worth reading it and thinking about how you would follow it in different age groups. Clearly, advice on concussion for a 3-year-old is maybe not going to be the same as advice in a teenager. The bedrock of advice for concussion is about brain rest and about graded return to activity. Brain rest in a 3-year-old looks very different to brain rest in a 13-year-old, and think about and pragmatically how parents are going to follow it. You can't give any certainty about timescales from the ED because you don't have any. So, talk about the fact that it could be very different, but be very clear that you can't give any certainty. Now, these kids are going to have to go back to school at some point, and I just want you to have a think about how you'd feel going up to a professional who's not been involved and said, the doctor's told me my child has to stay in bed until he feels better. He can't watch TV, he can't read anything, he can't do any schoolwork. Have a think about what that's going to sound like. It's going to be a difficult thing to say. One of the things you can do is give them another copy of the advice leaflet, so it's really clear to the school that this has been from a professional and it's not something the parent has just made up. It might be worth doing a bit more of a detailed letter, and again asking the parent if they'd like another copy to give to the school, just to back them up a little bit. This can be particularly important in children who have had other academic problems or are prone to risk-taking behaviour, and these may well be the people that you see with concussion. If there have been problems with their school in the past, the parents might be really reluctant not to send them, but it is quite important that they stay at home and rest properly. So print off your advice, be aware that schools may not be sympathetic, and the parents may need a copy of your advice for their work. Obviously, that's absolutely fine for them to take it, but there are confidentiality issues. So if you're giving them extra copies to give to other people, document that you've done that and they've consented for you to give medical information about their child to somebody else. Just be aware that small children may have trouble following your advice, but be pragmatic. If the toddler feels well enough to get up and run around the room, they're probably well enough to get up and run around the room. And give parents permission to use their parenting skills. They know when their children are feeling rubbish, and they know when they're getting ready to get better. And you need to give them permission to do that. Don't forget the risk of concussion in the long term. We know that recurrent head injuries have long-term consequences, and that re-injuring yourself when you've got a concussion particularly increases the risk of things like short-term memory problems, long-term memory problems, and also emotional problems. When you're thinking about these things, please do consider what their career aims are, what level they're playing sport at. We do have a significant minority of children who present to us who play sport at a high level. How are you going to motivate them to take a break from their training? And how are you going to let their coach know that really is the right thing to do? Remember that minor injuries are one of those things that if you manage it wrong, it can have long-term implications for the patient, and just do take some time to explore what this is going to mean for them.